Thank you very much. I'm Jo Boufford. I'm the president of the New York Academy of Medicine, and I'd like to welcome those of you from out of town to New York City and to the New York Academy of Medicine. We're delighted to be hosting this forum on public-private partnerships for global health and safety of the National Academies of Medicine, Science, and Engineering. For the second time, we were happy to host you this time last year, and really pleased that you've returned. As co-chair of the forum, with my colleague Clarion Johnson, whom you'll see later in the day, and the members of the forum who are seated around the horseshoe, I'm very happy also to welcome all of you to this two-day public session of the forum on the topic Engaging the Private Sector and Developing Partnerships to Advance Health and the Sustainable Development Goals. The forum was established in 2013 and its members appointed by the presidents of the National Academies, the goal being to illuminate opportunities to strengthen the role of public-private partnerships in meeting the health and safety needs of individuals and communities around the globe. This has meant sharing experiences among members, which are very wide and broad, members coming from multiple corporate sectors and also members from civil society organizations and academic institutions, as well as working with staff to identify the evidence base to contribute to best practices that facilitate effective performance, stewardship, and evaluation of PPPs to reduce the burden of disease, and including the goal of interventions being to build capacity among partners across all sectors and within countries to improve health. Since its beginning, the forum has collaborated with other forums of the National Academies on workshops on issues like health workforce, universal health coverage, evaluation of communities, values, and health programs, lessons learned in public-private partnerships, health systems strengthening, and most recently, shared value and global health and safety. And summary reports of those meetings are available on our website. This current workshop brings the background knowledge and collaborative explorations of those topics to the role of the private sector in the critical issue of the Sustainable Development Goals. I want to thank the forum sponsors, and I'm very happy to introduce the Vice President for Global Programs of Becton Dickinson, Renuka Gadde, who will introduce you to the objectives of the workshop and give you an overview of the workshop program. Renuka?
It's been a pleasure working with Jo and the planning committee members. And before I start, I'd like to acknowledge Rajesh Anandan, Simon Bland, Bruce Crampton, Kate Dutson, Ben Hoffman, Alison Tuman Campview, and Lou Valdez, not to miss Rachel Taylor right here, who's been really instrumental in shaping the agenda of this couple of days that we're going to witness. I'd also like to welcome the webcast participants. I understand we have quite a few signed up who are joining us virtually. And as we go through the Q&As during the session, we'll make sure that we call upon them as well. For those of you around the table, please raise your tent card when you have a question and speak into the mic. The Q&A session will be open to all attendees in the workshop, including our virtual participants. So Jo asked me to tee up the expectation of the workshop for the next couple of days. Day one will really be focusing on global challenges, and day two is the local level implementation. But what are the challenges that we're trying to address? We're really looking at how do you engage private sector in developing partnerships to advance health and sustainable development goals. I work for BD, as Jo mentioned, and in January earlier this year, we actually took this entire sustainable development goals and said, what does that mean to a company like BD, which is a healthcare, a medical technology company, and shared this with the company's leadership worldwide to say SDGs are not external, they are very relevant to us. And I know that several other companies around the table here and elsewhere have been looking at the SDG framework. So this workshop is very topical. You'll hear from several speakers, including Gary at BD, who will talk about what does this mean for BD and how are we then taking the private sector role into actually accomplishing and scaling SDGs, but in conjunction with a collaborative model where we are also engaging public sector and other partners, because the entire theme is sustainability. And in order for the whole proposal to be sustainable, you have to build upon a framework that's new. There are so many examples in public health and global health, particularly starting early 2000s, whether it's global immunization or the HIV/AIDS pandemic, where we've seen responses that can be catalytic in addressing goals. And when you have an ambitious SDG goal, with health being one of the 17 goals, the only way, or the one way that we can catalyze our response is by engaging in this collaborative effort. And that's the theme of the next couple of days. Throughout the day, we'll have panel discussions as speakers, request active participation, because your input will help shape what we hope to develop as an actionable framework at the end of this, going forward for the next workshop in October, that can easily lay out the different models for collaboration. Because even today, even though this is well discussed and well known, public-private collaborations don't happen that often or are still deemed complex. And so this actionable framework, we hope, will be a great guide to move forward. So that's the essence of what you're going to witness in the next couple of days. With that, maybe Joe. Perfect.
Okay, thank you. Let me just provide a few comments as background to this opening session on SDGs, the private sector, and health. As most of you know, this is the second generation of global goals for development, the first being the Millennium Development Goals during the period 2000-2015, which focused on advancing social and economic development for low and middle income countries, and were to serve really as a guide to international development assistance towards national implementation of those goals. Based on a review of the progress on the MDGs and a widely consultative process among member states, civil society, academia, professional organizations, and businesses over the last 2 or 3 years, a new set of goals has been developed for 2015 to 2030. And these are called the Sustainable Development Goals, if we could put that. There they are. That's my favorite info thing about David. I think that's really lovely. On the MDGs and SDGs, and the goal is really to address the unfinished agenda from the MDGs and to reflect the need to attend to new realities, such as non-communicable diseases, the fact that over half the world's population lives in cities, and that these goals apply to all countries, and they're all expected to develop a national implementation plan, not only low-income countries. For the health agenda and the SDGs, they reflect a strong and emerging evidence that health is not just a result of development, but a critical input into the health and economic and social development of countries, especially the health of women and girls. And it also reflects a greater understanding of the broad determinants of health beyond health care. In a sense, while number 3, as you'll see here, is the formal health goal, health is clearly a factor in this broader definition in all 17 goals. Number 1, ending poverty, economic development is a critical health issue. Number 2, ending hunger and food security. 4, the quality of education. 5, gender equality. 6, water and sanitation. 7, access to energy. 8 and 10, dealing with inclusive growth and addressing health disparities both within and across countries. 11 being safe and sustainable cities. 12, 13, 14, 15, dealing with the sustainable use of resources, climate change, and life on water and land. 16, peace and strong institutions, and finally, goal 17, partnerships, which is really the focus of our conversations, and for the first time ever, really calling out explicitly the need for private sector engagement in achieving the SDGs. We're very fortunate this morning to have as our keynote speaker Dr. David Nabarro, who is Special Advisor to the UN Secretary General on the 2030 Agenda for Sustainable Development. In this role, he works with member states and other relevant stakeholders to galvanize action on implementation of the agenda while overseeing the Secretary General's special initiatives such as Every Woman, Every Child. David has more than 30 years' experience in public health, nutrition, and development work at national, regional, and global levels, and has held positions in non-governmental organizations, universities, national governments, and the UN system. He really is the go-to guy for the most challenging and complex global problems, health problems in the world, and we're delighted that he's focusing his attention on sustainable development goals. Our plan is for David to speak for about 30 minutes, and then he's agreed to a Q&A. We'll do it up here and open to the group. So, David, if I can invite you to the podium.